Good morning. We got a great show today. We're welcoming you to health as usual. Of course, welcoming you doesn't mean you need to come in. It's just an invitation to something that you can do for yourself. We always emphasize, by the way, that when it comes down to actual health, it's not a doctor's responsibility to get you healthy. It's not my responsibility, certainly. It's your responsibility to get yourself healthy and keep yourself healthy. You've got to keep awake. You've got to keep listening. You've got to evaluate information. Don't trust anybody with your health except yourself. And of course, then you've only got yourself to blame. But, let's face it. Let's look just straight at it. Let's look right in the mirror. Most of us know what makes us unhealthy. Most of us know how we can give ourselves a cold, how we can give ourselves the flu. Most of us realize that all you have to do to give yourself a cold or the flu is to stay up late, to abuse yourself with all kinds of, lack of sleep, the wrong foods, eat lots of sugar. I mean, we've done that experiment over and over and over again, and we know the kind of results we get. If you haven't, by the way, been paying attention, then you need to start. You need to start knowing what it is that the methods that you use to make yourself sick. And a lot of people, of course, have psychological background for it. They, feel that if they can keep themselves sick and keep themselves pathetic enough, then there'll be people around that will want to take care of them. And let's face it, it's kind of nice to have somebody who, says, well, okay, I'll sacrifice my life to babysit with you. And sometimes it's legitimate. Let's face it. We have accidents. We have things where it's important to kind of take a parenthesis in our own life to take care of the people we love. But there are also people, and you know who you are, that have a ulterior motive to your own sickness, and it's something you need to deal with. On the other hand, there are circumstances that are outside our control. So let's kind of modulate those, but keep in mind that a lot of what we experience as health problems was our responsibility. We worked into it ourselves. We have to take full responsibility for it. And of course, most of us know these days, because there are fewer and fewer people who smoke tobacco, but most of us can very easily look at those people and say, you know better, you knew better, and it's, you did it onto yourself. But then again, we sometimes have a more difficult time looking back at ourselves and admitting to the things that we do to destroy our own health. In any case, the main topic today is going to be coming up, and I'm going to tell you what it is as soon as two things happen. Number one, I remind you that on Tuesday evening, we do have a weight loss seminar. And by the way, this is one of those ways you can take control of your health, because we all know, and if you listen to this show very often, you all know the mechanisms by which we raise our whole body inflammation and leave ourselves open to high blood pressure, high cholesterol, type 2 diabetes, extra strokes, muscle disease, joint disease, hardening of the arteries, cancer, and even depression, because we've raised our body's inflammatory picture by not watching what we eat, not getting enough exercise in, etc. So what we're doing at the Welcome to Health Centers, we're actually offering you an opportunity to take control of your health. We're welcoming you to health on Tuesday evening at the Tuesday evening seminar. Now, just recently, one of the major purveyors of great weight loss programs in the Quad Cities has closed, and they are kind of channeling their people over to us. So if you're one of those people who had used the Ideal Protein weight loss protocol at CVM, cardiovascular medicine, and if you know anybody that has done that, then channel them over to Welcome to Health. We have done the protocol since 2010. We know it like the back of our hand. We know all the ins and outs of it. We have the best coach possible in the Quad Cities, and make sure that they know that we're over there and that we're available to take over their program, because I think there's a lot of people out there that are just wandering around and not knowing where to go next. So if you know anybody who was on the Ideal Protein protocol with that particular organization, channel them over toward us. And if you're interested in actually taking on this health journey and lowering your whole body inflammation by lowering your fat load, this just last week we had several people. One of the things I do in the clinic is I actually will take the people back to our therapy room, and one person this week lost 50 pounds, and I loaded them up with weights. I put these big iron weights in their hands that equaled 50 pounds and had them walk down the hall. And they said, oh my gosh, my knees hurt again when I did that. My ankles were, oh, no wonder I was so miserable. And then they came back and they gratefully, I took them off of their hands and they just bounced down the hall like it was just nothing. It was like they're walking on the moon, you know. And that's kind of the experience that people have. But it's not just the effect of the weight on the joints. It's the effect of the inflammation that is caused by this overload of fat cells that are producing, overloading you with estrogen, and men just don't need estrogen, believe me. You know, they don't need the body transformations that estrogen promotes in both men and women. But they, you know, that's kind of eliminated. They feel more like exercising. They feel more like they used to when they were young and lean, and they really profoundly appreciate the difference. So come on over to the Welcome to Health Center. I know that health's not for everyone. You know, you can continue on your path and do, you know, health destructive things, you know, as long as you want. And I support you in that because that's your decision. As long as you take full responsibility for the outcome, I can, you know, say, yeah, go for it. That's what you want. But if you are in a position where you're kind of sick of that and you realize, wait a minute, I really don't want to take full responsibility for this outcome, but I guess I'm going to live the outcome anyway, then you might want to start taking responsibility. Start actually saying, yeah, I guess trying to avoid it is the last thing I want to do because that has not worked. It's not working. It's time to take a step. Well, one of the easiest steps to take is going over to the Welcome to Health Center on Tuesday evening at 6:30 and listening to a talk on how you can, in the at least the easiest way I know, the most painless way I know. If I could discover an easier way, by the way, we would be offering that protocol in the clinic. But this is the easiest way I've discovered to actually start your weight loss journey and start the weight loss protocol and actually have tremendous results. I have to say that the people who have done the protocol and have been strict on the protocol lose the weight. And it's not just weight they lose, it's the fat weight. And that's the only weight you really want to lose. You do not want to lose muscle weight. That's very, very dangerous, actually. So, okay, well, the topic today, I just want to cover it briefly because it's been on my mind a lot lately. We're starting to see more people with chronic neurological illnesses. And part of the reason is because the kind of testing we do the genetic testing for neurological illnesses. We also do food allergy testing, and we do nutritional blood work. And we find that there are certain patterns that are very important to understand, because if you can bring those patterns that we find in these different tests back more into alignment, then it makes a big, big difference. But what I want to focus on today is Parkinson's disease, or Parkinsonianism, because there are lots of different things that affect movement. And Parkinson's is one of those diseases where movement is profoundly affected. One of the things that you notice most often is that people just start slowing down. Their gait starts becoming a shuffling gait. Their balance is a little off. They have a tremor in their hands. And those types of things are really, and sometimes, frankly, the things that people notice before anything else is that they just can't get going. They're sitting on the couch and you ask them to do something, and normally, you know, in their past, they would just jump up and go at it, and no problem. When they wanted to do something that, you know, for themselves, they would just jump up and go at it. They were highly self-motivated people, but they just sit there. And, you know, a lot of people get mad at them, you know, they get very disturbed and like, you know, what's going on? Why aren't you doing what you want to do? Or why aren't you? And it's just that the thing that the Parkinson's does is the part of the brain that produces dopamine, and I'm not sure why it's called dopamine, because that sounds kind of dopey, right? But it's the absence of dopamine that's the problem, okay? Because the substantia nigra, which is a part of the brain that has some black substances in it, the substantia nigra is not producing dopamine according to the right signaling, and as a consequence, people have a difficult time initiating movement, They can't start movement and they can't stop movement easily. So once they get started, like in a walking pattern, they can walk fine, but trying to stop sometimes causes them some balance issues. But just even initiating movement at all takes a great deal of effort and concentration and focus. And sometimes they just can't do it. They're just kind of frozen there. Okay, so that's what is happening with Parkinson's. And the cause of Parkinson's is unknown. It's called idiopathic. Idio, of course, sounds like idiot, and that's correct because idiopathic means that we don't know what the problem is. We don't know where it comes from. We don't know what its origin is. And so, and that can apply to any illness, of course. You know, there's lots of idiopathic illnesses where we don't know the cause. But we know the effect, we know the symptoms. And the primary therapy for that is to give the patient dopamine, or levodopa it's called in a lot of cases. A couple other products too, but that's the main thing. You give them dopamine, and then they can initiate actions again. Okay, so what's the problem? What's the problem? So we have a medication for it, and therefore, what's the problem? Well, it's a progressively degenerative disease. It continues to going. It's not just because you have a medication, you're just fine and you're going to be fine forever. No, because what happens is, like many other things, like opium, for example, you take a little bit, you get the effect you want, and then a week later, you have to take more to get the same effect. And so you give more and you get the same effect. And pretty soon, the opiate receptors on the cell membranes have been reduced to the point where no amount of opium gives them any kind of effect at all. And then it's all withdrawal from that point out, because just to keep yourself normal, you've got to take massive quantities of opium. Well, L-Dopa is pretty much the same way. What happens is that when you start out, the L-Dopa, the medicine just seems to be miraculous, because you can move again, you can think again, you can initiate and stop movement again. But after a while, your dopamine receptors get worn out and they start withdrawing from the cell membrane, and so you need to use more of the medication and then more. And just like insulin, just like opium, just like, again, dopamine, when you use a little bit too much, it fatigues the receptors and they withdraw, and then you have to use more. Eventually, no amount of medication works. And that's when things like dementia and these types of things also become complicating problems with the condition of Parkinson's. Okay, now, interesting though, is that nutritionally, there has been a tremendous amount of success in the world of nutrition on these progressive degenerative neurological diseases. And there's no example. This was almost a punctuation point, an exclamation point in the entire nutrition world, when the doctor at the University of Iowa, Terry Wahls, came down with progressive multiple sclerosis, MS. Now, why was that such a significant event? Well, first of all, she was an elite athlete. She was one of the great professors at the University of Iowa, and there are very many of those. And she was a star. And suddenly she started having problems. And MS is, like Parkinson's, a progressive neurological disease that it continues to progress and things continue to get worse. Well, she was in this journey for years, and after a couple of years, she went to the best, I believe it was the Cleveland Clinic, and they were the top people. They had the most advanced science, they had the most advanced medications for MS, and she went under their care, and she just kept getting worse. And in her 7th year, I believe it was, by the way, you can go on YouTube, and there are like huge numbers of interviews of Terry Wahls. That's Wahls. She's done TED Talks, which are short talks that kind of summarize her experience. But listen to those interviews, because they are absolutely phenomenal in giving you information. If you have a relative, a friend, or if you have a Parkinson's, go to those. It's just so vital that you view this stuff. So anyway, she was getting so bad that she couldn't walk anymore. She was in a reclining wheelchair, which meant that it had to be at an angle because she couldn't even lift her head. Now, she was still working at the university, but of course her duties were radically declined, and they actually, at the very last, this was the last straw, they reduced her load to the point where she knew that they were trying to phase her out. And she, didn't blame them, of course, because her condition was awful. Well, after a brief time, she realized that the medications were not working. And she was researching like crazy. And if you do any research, particularly with search engines like Medscape News, they come out with lots of articles every week on summarizing all the research. It's a wonderful resource. And she was reading all of the research papers on her MS condition. And of course, she was noticing that a lot of them were based on nutrition and how nutrition works in the entire process of maintaining the substantia nigra, or in Parkinson's, or the nerve sheath in multiple sclerosis. And she was getting all this information, and she realized that, wow, this may hold something. So she started taking vitamins. And at first, she realized that, I don't believe in vitamins anyway. She would stop taking her vitamins, and then she would have about 3 days when she wasn't taking the vitamins where things got worse. So she went back on the vitamins again, and then things got better again. She became far more functional. And then she was, like most of us, were skeptics and we're also lazy, and she stopped taking the vitamins. And again, the next day she would crash, and she would spend several days where she was just in bed. She couldn't even move. And then she would take her vitamins again, and things would get better again. She said, my gosh, there is something here. And then she went completely in. She started avoiding all the foods that caused her problems based on, I suspect, although I don't know, but a lot of these tests weren't even available back then in the early 2000s. But I suspect that she probably had some food allergy testing done, like the one stuff we do in the clinic. And she started avoiding the foods that were causing her big problems. And she started eating a variety of greens, and she would have these huge salads every meal with lots of colors to get all of the plant sterols and all of this. And she really beefed up her diet literally with grass-fed beef, which is high omega-3, and she took fish oil supplements, and she ate lots of fish, to get the omega-3 fats and the polyunsaturated fats that are the right sort. And my gosh, she started getting much better, and the recovery was absolutely miraculous. Within 3 months, she was back walking the halls of the hospital, riding her bike, teaching, standing up, just absolutely miraculous. And it was because she was giving her body what it needed to overcome the problems, to actually grow her nerve sheaths back again, or at least really interrupt the decay and the demise of her nervous system. So go to Terry Walls. Go to the YouTube videos and read articles on her, because she is a hero of how it is possible to take a neurological degenerative disease, idiopathic, no one knows the cause, and bring it back to where you can be far more functional, and I would say even probably reverse most of the problems that, we create for ourselves by eating the standard American diet, frankly. It's just amazing. To me, it's amazing that people can live as long as they do and be as healthy as they seem to be on the standard American diet. I know I can't. When I eat crappy food, I experienced crappy life. I start going downhill. And I know it. I've learned this back when I was in my 20s. I'm not healthy enough, apparently, to eat that junk. Okay? Just like I'm not healthy enough, apparently, to drink lots of alcohol. Why? Because I know I do not like the results I get. Being drunk, that's the least of the problems with me when I drink alcohol, when I do these things. People would call me a teetotaler. Why? Because I feel good on tea, right? And I just don't handle that other stuff very well. So I would be stupid, absolutely stupid. No one could welcome me to health if I did that kind of those kinds of mistakes. It just doesn't work for me. Well, obviously, people with neurological diseases, there's something not working for them either. All right? So just a couple of suggestions on what I would recommend in terms of how to deal with these kinds of issues. Number one, I would recommend you get a relationship with the Welcome to Health Center, a relationship with me, a professional relationship, because frankly, until I have a professional relationship with you, none of my recommendations really count for much. Why? Because I can't really explain things behind the scenes. I can't look at your particular condition. And also, frankly, when I make these nutritional recommendations, nutrition is not something that the FDA focuses on. So I kind of have to say a disclaimer. None of these recommendations I'm making to you right now and in the future are evaluated by the FDA. It's just not. Why? Because the FDA doesn't evaluate things that are in the public domain and that can't be patented. They're there for those people who want to make patent medications. And those people are all about the profit of being able to own certain chemical compounds. We've kind of gone through this on the radio program before, where if you can't patent it, you can't own it. If you can't own it, you can't make billions of dollars. You are reduced to selling something that anybody can sell if they have a source. And so you've got to patent it before you can charge huge bucks for the drug. So we're talking about nutrition here. This is not evaluated by the FDA. These are just recommendations. These are things that, but I would still love forming a professional relationship to you so we can really get down to your specific problems. So what do we do in the Welcome to Health Clinic for neurological diseases and neurodegenerative diseases? Well, the first thing we do usually is we do genetic testing. We find out where your weaknesses are. Because genes, once you have the genetic test, you can bring in your 23andMe if you want to, if you have that already. We'll look at it. But with a genetic test, you don't tell a person, what they're necessarily going to manifest. What you tell them is where their capacity to deal with stress probably is. In other words, they have a certain stress capacity. Imagine that their stress capacity is 10. And as long as their stress in their life due to nutrition, eating, toxins, exercise stress, job stress, family stress, as long as that doesn't get any higher than like 9, they're fine. They don't experience big problems. But you take a person whose stress tolerance is 10 and their stress is like 15, they're going to have big problems. And that's what evaluating genetics is good for. But we also do food allergy testing, which is one of the possible stresses. There are some people who cannot have eggs in any of their food, or they just go off the chart. Terry Walls is one of those people. They will suffer for weeks for having one egg today. They will suffer for the next 2 weeks, and they'll have to pull themselves out of the horrible condition by their bootstraps by not having those things. But so it's very important to know what foods you're allergic to. But we also do blood nutritional testing because you can read the blood. For example, if you have high homocysteine, that means you're low on vitamin D, on vitamin B vitamins, 6, 12, etc. And your stress handling capacity has been outstripped. Well, all of these things are important. So give us a call at 309-764-2115. Make an appointment if you have any of these problems, and we're going to sit down with you and talk through them. And we're hopefully going to get you into a position where you can handle these things, not with medications that literally wear out in the use and leave you in a worse situation. But we're going to build your health in your body so that your healthy body can handle the conditions and the stresses that you face on a daily basis. So give us a call. They'll give you the number again in the promo here, and we'll talk to you soon, hopefully. Bye-bye.